All right, we are live. Wonderful,
Welcome,
wonderful.
everyone. Yes, welcome everyone to another Facebook Live with Dr. Nelva Bryant. My name is Greta Russo, and this is Dr. Bryant. Please, Dr. Bryant, introduce yourself to folks who may not know you.
Hi there, everyone. I'm Dr. Nelva Bryant. Thanks for following and listening to us. I'm a veterinarian and I work in the airline industry. I work with Delta Airlines and I've been on staff with them for the past few years. You might wonder why. Well, animal welfare and ensuring animal welfare regulations for all animals is really important when transporting animals. So I was brought on staff to help review and revise policies, ensure compliance with regulations. So that's what I do with them. And I'm thankful for that role. Um, Based upon that role, though, I've noticed that I kind of have got an insider view of pet travel or animal transportation in general. And I developed WhenPetsFly to kind of share information to help better prepare pet owners, fellow veterinarians on animal transportation, basically. We have these Facebook Live events, which that was really a great idea of Greta's, and we've kind of transitioned over these past, say, 2.5 years of doing them, where initially I thought we were going to just focus on sharing information to ensure pet owners are ready, preparing their pets for air travel. But we have really expanded beyond that because we have numerous folks we invite on here. As I always say, different stakeholders in the animal transportation industry. And we just share different topics. We could talk about, sometimes we talk about service dogs. We talk about sometimes pet shippers we have had on here as well. We talk about different forms of transportation. Some folks are interested in transporting their pets by jets. So we've had two companies to come on and discuss that. We just do a lot of different things. And today I'm really excited because we're going to hit on something that's extremely, extremely important regarding particular pet breeds. Your brachycephalic breeds, your snub-nosed breeds, or they call it short face. I don't know. There's a lot of terms out there for them, but either way, it's the cute dogs that we love so much. Our pugs, our French bulldogs, English bulldogs, Shar-Peis. I mean, the list of these breeds, brachycephalic breeds, is actually very long. So we're going to discuss that today. But before we go there, Greta, I see your kitty wants to be a part of the show today, but introduce yourself and your kitty. How about that?
Well, hello, everyone. I am Greta Russo, and I am on this journey with Dr. Nelva Bryant in helping to educate people so that we can all travel safely and securely with animals. That was Jon Snow who left left the screen. One of my three cats.
He had his cameo. He had his cameo appearance.
Yeah.
There you go.
Yeah, absolutely. But yes, so it's definitely been a fun journey, and we've been learning a lot on this journey, and sharing things about the animal transportation world. I just got back from Las Vegas, where there was Super Zoo last week, and met so many amazing established as well as new companies that can be a part of a pet parent or animal's journey in travel. And it was really amazing. I did about 10 live videos from Super Zoo, introducing everyone to these different vendors. And I hope you all had a chance to check them out. But it was from, let's see, different companies. I spoke to Lucy Pet Foods, which is an old friend of mine, and I absolutely love them. And that we were talking about nutrition and keeping your pet's nutrition as the same as possible while you're traveling. And they recommended some of the products that they had. I also even met a stroller company, Amoroso Strollers. And I got to tell you, Dr. Bryant, I remember when strollers first came out and people were using old baby strollers, which they still are, but they were decorating them. Like they would look like a float that should be at the Macy's parade. with all the tulle around it and everything, because they would put their cats and dogs in it. And now they're just like umbrella strollers, the real thin, streamlined ones. And even Disney's got in on the act, and they've got themed strollers. So that was pretty cool. Let's see. I had a chance to meet a company called Guru Pet Company, and they provide enrichment toys for dogs. So of course, you know, the dogs are working to get the toys, and what they love is that they can stay active while sitting in their carrier or kennel and not getting weirded out by the noises or the smells that they will encounter while they're at the airport and everything. And then also the company, I'm sure a lot of our audience knows, it's called Pet Parents, where they have a lot of products for pet parents, and a lot of them are geared towards traveling. So they've got like wipes, and they've got collars and harnesses, as well as leashes and everything you would need, the bags. They also, I think they have some carriers and stuff like that. An old friend that I ran into, Teeth for Health. That is a company, woman-owned company, ran by a scientist who created a powder that you can put in your dog's water or sprinkle over the food, and that would pretty much neutralize the bad bacteria inside your dog's mouth, and get rid of the tartar and everything. So you know, that she was talking about, even with traveling, you know, this is a self-contained powder that's in a container, and that easily travels, so you never have to stop taking care of your pet's health, as far as their mouth health and everything. Let's see. I ran into Moe's Healthy Pets, which provides chill out chews, which is a way of helping it does not have any CBD in it, and it has different spices or something that is more on the science side, natural side, to help regulate your dog's mannerisms, so that they're a lot more calm in any situation. And they usually, you'll see an effect with them 15 to 30 minutes after taking them, but they are relaxation type of not supplement, because they are chews. And so I thought that was interesting as well. So I definitely ran into a lot of great companies, and you can check them out on our IG page, the different companies that I spoke to. I
think I'm going to have to switch to my phone, because I'm having an awful connection with my computer. Am I going in and out for you guys?
Yeah.
This is weird.
Yeah. But you know,
I'll pop out just if you don't mind.
Sure. Mm-hmm. I just kept talking. But you know, Dr. Bryant, our audience is used to us having technical difficulties anyway. Well, I'll keep going. So anyway, so that I had a really good time at Super Zoo. Hello? Yeah, you were frozen for a second. So I had a really good time at Super Zoo, meeting all those different people. Even more surprising, I got to meet different celebrities while I was there. And so I'm sure a lot of everyone knows Shorty Rossi. He used to have the TV show where he was also helping to spread the word that pit bulls are not the ferocious animal that people think they are. And he had a show that was around that for 6 years. And it was very popular, but it's not on TV now, but he's still a beloved star within the pet industry. I also got to meet Brandon McMillan, who is an Emmy-winning host of the Lucky Dog Show. He was there as well, and he's also a trainer. And then I got to meet the cat daddy. Everyone knows Jackson Galaxy.
Greta,
Yes.
Greta, I'm gonna pop off because my connection on my computer is awful. I'm going to join through. Hold on. And my connection is really, really bad. I'm sorry.
Okay.
Can you hear me now, or I don't know if I should or not because this thing is. Hold on, please use this. And this is the one. Let's try the Chrome. Keep going. I'm sorry. And we may honestly, because of this connection, guys, we may have to redo this. And I'm sorry, Dr. Boaz. This is not normally. It's not my computer's never done this, so I really apologize. I don't know if we should just try to push through or what, but my connection is not good. And I don't.
Are you going to switch to your phone? Well, you're frozen now,
Can you hear me?
so yeah, I can hear you now.
Okay. I don't know if we should push through or how we should do this.
Well, do you want to bring Dr. Mann on?
Let's go ahead and bring him on and do the best we can, guys. I'm sorry, my system is really messing up, but I don't want to interfere with this really valuable session that we're going to have today. Thank you, Greta, for sharing your information for Super Zoo. I was kind of jealous. I wish I was there too with you. You look like you had a blast. But what I want to do is bring in Dr. Boaz Mann, who is a specialist with handling brachycephalic breeds and doing laser surgery with him. I met him through Dr. Adam Crispin. And my goodness, I think it's great that we've combined to share information because there's things about the breed that a lot of pet owners are not aware of. And having this breed and air travel, really, if you're not informed, it's, in my opinion, it's almost a disaster waiting to happen. And unfortunately, there was a situation fairly recently where a brachycephalic breed dog, a French bulldog, died during transport and in cabin, actually. And, you know, it brought a lot of issues where is it the airline's policy, who's at fault, and all these different things. But let's just look back into the basic thing of the pet itself as far as the breed. And so you'll have a better understanding of the breed and the complications that's inherent within them. So I've got Dr. Boaz Mann here to really share information with us. So yes, could you bring him up, please?
Sure.
Awesome. Hello.
Hello, how are you?
Hi, Dr. Mann.
I am great. I'm so happy you're here. So happy. Yeah, we've been sharing a lot of information these past couple of weeks on brachycephalic breeds because I really think you need to have a good understanding of the breed. And as I mentioned, their inherent traits or physical abnormalities, basically, that comes with them. I mean, they're the cutest things ever. I have brachycephalic breeds, myself, 2 dogs. I love them, but I recognize that transport by air, there's some issues you have to address based upon that breed. And I just want an expert to really share more information about it, who has clinical experience and with dealing with them. So please, Greta, you want to go ahead and do this introduction and then we'll jump right on in? It's up to you guys how you want to do it.
I'm going to introduce them and then we'll get started. So Dr. Boaz Mann is the owner and medical director of Boca Midtown Animal Hospital since 2013, which is an AAHA accredited as well as a fear-free certified veterinarian practice. Dr. Mann earned his bachelor's at the University of Miami and Doctorate of Veterinary Medicine from Ross University in 2004. And he grew up surrounded by medicine, with his father and both grandfathers being well-respected doctors. Dr. Mann, 20 years of experience in private practice, and is passionate about staying up to date on continuing education and the latest and greatest in veterinary technology. Being the sole practitioner, he often involves veterinarian experts to help provide the most thorough veterinarian care available. Dr. Mann serves on the Fear Free Advisory Board and is an editorial advisory board member for the DVM 360, and regularly contributes content for the printed magazine as well as for their social media. Dr. Mann is excited to have recently published a cover article for the DVM 360 magazine April issue, in which he discusses addressing Boaz, which is BOAS, in general practice. He enjoys sharing Instagram video blogs, which is at Boca Midtown Vet, educating pet lovers on hot topics, and enjoys educating pet parents through his YouTube channel, Dr. Mann. Dr. Mann has presented hot topic general practice lectures at Fetch DVM San Diego and Kansas City, and laser surgery lectures at the VLSS in Los Angeles and San Antonio and San Diego. Everyone, please help me welcome Dr. Boaz Mann. Oh, we usually have a Dr. Bryant there and a clapping machine going off, but here she comes back. But Dr. Mann, we are so excited to have you. So excited to learn more about your topic and what you do with your business and all of that good stuff. But let's get Dr. Bryant settled in. You're on your phone now? Is it better for you?
I'm on my phone now. It's better connection. Hopefully it won't have that problem again. I apologize. I apologize. I feel like this is one of the best. We advertise this one so much and really want this to be a great event, and here my computer messes up. So let's get it going. Again, I'm excited to have you here, and thank you so much for joining, Dr. Boaz. Thank you for that introduction to Greta. Again, just to pet travel, Brachycephalic Breeds. Any thoughts on that right now before we get into your stuff? What, Jesus.
So the question was about pet travel.
Dang it. What is wrong with my having trouble connecting me? This is off.
I think we're having some technical issues, but that is part of life when we do a live event like this, and it's not unexpected. Maybe things will improve here in a minute with the streaming.
Let's cut it.
So,
guys,
let's see. Dr. Mann, why don't you tell us about yourself and your practice?
Went through all this.
Well, thank you for having us. As far as the reasons that I wanted to join and speak with Dr. Bryant today were for a number of reasons. I'm a veterinarian here in Boca Raton, Florida, at Boca Midtown Animal Hospital, and I've been a veterinarian for about 20 years now, since 2004. And over time, things have changed in veterinary medicine, as everyone is aware, and of being proactive and recognizing problems in pets early. We have all learned over the years that things can change and that we can always do better. And I am very proud to be part of this profession because we are a profession that is open to change. We are often doing things like we're doing today to collaborate, to learn from others about how to provide better care for these pets. And I am thrilled to be involved with helping dogs that are brachycephalic dog breeds breathe better. And Dr. Nelva did introduce me as a specialist in brachycephalic breeds. And I wanted just to kind of correct the situation a tiny bit. I have a special interest in laser surgery. I've been a laser surgeon for 20 years. I also have a special interest in helping brachycephalic breeds breathe better. And I happen to have, the advantage of being a laser surgeon for many years and seeing a lot of brachycephalic breeds, and have learned how to intervene with laser surgery at an early age to help them breathe better. So I am in general practice. I am not a board certified surgeon. And to me, that is very critical because people need to understand that this condition can be corrected in general practice because this is a soft tissue surgery that every veterinarian is capable of performing in general practice. And one of the reasons that is so important is because there are so many of these dogs out there that need so much help. And we cannot afford to wait and see if they get better on their own before they get really sick and then need to be referred to a specialist at a 24-hour facility. So if we can start taking them on early on in general practice, then our chances of helping these dogs and beating this problem become much higher. So I see Dr. Nelva is back on now. I think your connection has improved, but thank you very much for having me here today.
Oh, you're welcome. Well, I think,
yes.
number one, we should start off. I'm sorry. I think we should start off with so because we have so many different types of people that watch this, it's important to say what you're talking about, define it so that everybody's on the same page. And then if you could explain what the symptoms of it is, that would be great.
Absolutely. So the symptoms of brachycephalic obstructive airway syndrome are multiple and various, and they all point to a very large animal welfare problem for these dogs. They need to breathe through their nose and their throat, their upper airways, so that they can get oxygen to their lungs and so that they can breathe properly when they get stressed, when they get excited, when they're in situations that create fear, anxiety, and stress. And the symptoms of this condition are dogs that pant heavily, dogs that have an open mouth when they're breathing. And why do they go breathe with their open mouth and their tongue out? Because they can't breathe through their nose. So they're obligated to open their mouth to breathe as wide as possible to get airflow into their mouth. That is a big red flag when they have to breathe with their mouth open. When they start to have a change in color of their gums instead of being pink will change to blue or to purple. That is a sign that they're not getting enough oxygen. That is a critical problem that requires intervention with a veterinarian. Because they can't breathe through their upper airways, through their nose or their throat, they are compromised and they are at risk for lots of complications. The other symptoms of this condition include hacking, gagging, choking, regurgitation, spitting up. We have actually learned that these problems are called aerogastric problems, where there is a direct association and link with a narrow upper airway and a gastrointestinal problem. The enemy is called negative airway pressure, and that is what creates all of these problems. If you yourself try to breathe through a straw, you will understand what negative airway pressure is like. And this is what these dogs deal with on a daily basis.
Okay, so let me ask you this. Number one, I know as our resident cat parent here, there are brachycephalic cat breeds. So are you saying, since you're only talking about dogs, are you saying this condition does not affect cats? or you just don't deal with cats, or should cat parents with the smush noses be concerned about what you're talking about?
That's a great question. So there are cats that are affected by this problem. And there are breeds that are not our typical breeds of dogs that are affected by this problem. Just like with any problem, if your cat or your dog, any animal, regardless of the animal, has obvious symptoms of a breathing issue, they need to be investigated. And the only way to do that properly is by having a good relationship with your veterinarian and making sure that it is addressed in the right way. And cats can suffer from this problem as well as dogs.
Okay. Can cats get the surgery that you perform, that you recommend?
There are various different techniques that can be performed for cats. Cats can be a little more challenging to work with because they have such small air and such small noses. But there are surgical corrections that have various techniques with various success in cats. And I think the major talk that we are talking about today is a majority, overwhelming of the what we call extreme brachycephalic dogs. So we're here today because of the English bulldogs, the French bulldogs, and the pugs. These are what are known as the extreme brachycephalic breeds. And if you're not familiar with a recent study from Nationwide, the French bulldog, who's become the most popular pet in America for the last 3 years consistently, is 17 times, I'm going to say it one more time, higher risk for Boaz, followed by the English bulldog. The English bulldog is number 2. They get the silver medal, unfortunately, and they are 12 times higher, followed by the pug, which was in this limited study, actually it was 50,000 of these dogs, was number 10 times higher risk for Boaz. So imagine this study on 50,000 dogs that were insured. Now imagine how many other dogs are out there that were not in this study and that were not insured. They're everywhere. So it's a major problem that we're trying to address. And the key, again, is addressing it early on in general practice, and starting the conversation when we recognize a problem from when they are puppies.
Yeah. Now, and also another question that I have. So with travel, we know that airlines have their policies about certain breeds of dogs, in particular the brachycephalic breeds. So is there something that the airlines, and I don't know if it's at the counter, maybe that's the first line of defense. Should they be checking for something like as one more check over the animal, to make sure they're not in distress, or because I would imagine having this condition has to make it very difficult to breathe, even in cabin.
Absolutely. Again, the key is to have a very good relationship with your veterinarian from the start of their journey. Nope, we're having a little bit of feedback there. So when they are puppies, and when they come in for their puppy shot, we need to recognize if their anatomy is normal or abnormal, if they have signs and symptoms of this condition. Now, as far as checking into an airplane or going to a flight, hopefully the signs and symptoms of this are recognized early to prevent the situation that can happen when they do overexert themselves on an airplane. I would suggest that pet parents have thermometers with them, have lubrication with them, so that they can regularly check a thermal temperature. As long as their dog's thermal temperature is under 103, and it's consistently that way, then we know they are not at a higher risk for overheating during that flight. The other thing that we like to make sure of is that we can learn how to do a resting respiratory rate at home or when you're on an airplane. For these dogs, their average resting respiratory rate should be under 40 breaths per minute. If their breathing starts to increase, then that's a concern. They have a hard time breathing and their respiratory rate increases. That means that they may now be having also a lower airway problem. So they can start to have problems in their lungs, and they are highly susceptible and at risk for things like aspiration pneumonia because of their abnormal anatomy.
Okay. So, I've always known that pet parents of these breeds, they've got to keep a close eye on their babies and everything. And it's like, I had a couple of friends that had, one had a Frenchie and has a Frenchie, and the other one has a pug. And both of them kind of have the same nervousness to them. And my one girlfriend said that her Frenchie gets so nervous that he just starts sweating and he just starts freaking out. And so I guess that when they get nervous and cause all of these problems, it's harder for them to breathe. So I'm thinking, the surgery that you're speaking of, would this be something that you want to do early in the animal's life, because that breed is prone to this? Is this a corrective surgery that you would like to do in the early stages of their life?
Yes. So after the age of 6 months, their skulls have matured enough to have corrective airway surgery. And yes, the answer is early intervention will improve their quality of life in a major way. This is a game-changing and life-changing procedure. Correction of the upper airways will help them breathe, will help them with their airway obstruction, and will help them in situations where it's hot or where they're stressed, and when they're anxious. And so we used to have these exam room talks where, oh, yes, the pet parent would say it's a Frenchie, they'd laugh it off. That's what they're supposed to do. They're supposed to make these sounds. But when we recognize these sounds and these symptoms as an airway obstruction, and we discuss it in life-threatening complications in terms that pet parents can understand, then they want to move forward with helping their babies breathe better, because who wants to suffer without being able to breathe? Without being able to breathe, they cannot thermoregulate their body temperature. That is very important. They need to be able to breathe through their nose so that they can thermoregulate. And when we do wait longer for them to be older to correct it, the negative airway pressure that develops up here in the nose and in the throat, which we haven't spoken about the soft palate, but that's the flap that creates the airway obstruction in their throat. The negative airway pressure gets worse and worse. And over time, behind that soft palate is the larynx. And when that larynx starts to become weak, when that larynx starts to collapse, it can even become paralyzed. It is not a great thing to try to correct, because there are numerous complications associated with correcting the larynx. And unfortunately, some of these dogs have to resort to having the upper airways bypassed by something going directly into their throat, a tracheostomy, where they put a hole in the windpipe, or a tracheotomy that's permanent to leave a hole open to bypass this upper airway problem. And then those French bulldogs have complications where the hole can close, or they'll try to go swimming and then all of a sudden fluids in their lungs. So it's not something that you want to wait for to see if things, get worse. It's something you want to be on top of early on to help them avoid those problems.
What's the ideal age range that you would like to see a client come in?
Starting as early as 6 months, would be the earliest intervention, but after 6 months, there should be a conversation about when can surgery be scheduled. We see
Okay.
Frenchies that are a year old or a year and a half, 2 years old, 2.5 years old, 3 years old, 3.5 years old, and so on and so forth. And they do great. We don't want those dogs to get to middle age or to senior age because those risks for them are higher for laryngeal collapse. I've also unfortunately seen dogs that have developed polyps on their larynx. Those are little growths, and the polyps are a result of chronic inflammation and chronic irritation and pressure in the airways. So just so you can understand, the problems they have with their stomach are because of this negative airway pressure that builds up so high, they're actually sucking their esophagus up into their chest. And that's called a hiatal hernia. So these things are serious. These things are serious, and these things require early correction and early intervention.
Yeah, it seems, I think education definitely is the key because so many people are so used to hearing Frenchies make these sounds, and you think it's just them making sounds, but you don't think that there's a problem. Like most people think that's cute, that's them making that sound, instead of thinking, oh my God, they're gasping for air. So I think if with us retraining everyone to think that sound is not a cute sound, it's a bad sound. Just like with snoring, when people snore, that's not cute. So,
correct. Correct. That's a sign of an obstruction in the airway, and that is a sign. That is one of the red flags that is very common. So snoring, exercise intolerance, hacking, coughing, gagging, regurgitation, because this flap inside the throat, the elongated soft palate, sits there, and when they eat, saliva sits there, and the windpipe's right behind that flap, and it gets all swollen because they get excited, they get saliva in there, they get food in there, and they want to go and regurgitate it out. And getting the information is important. Getting a good medical history is important. All of these things are crucial to recognizing a problem. And you're exactly right. The problem is all of us. We love these dogs, and we need to do better for the breed. And we need to recognize when there is an active airway obstruction, how can we help these dogs, and how can we be better for them?
Absolutely. Dr. Bryant and I often mention that I love to learn. So I even though I'm in my 50s, I've been a pet parent since I was 4. So, I call myself a professional pet parent, but I still want to learn, because what we did back when we were kids to raise our pets is not what we should be doing today, because things have changed and we should be learning to be better. And I think this is a great example of that, in knowing that those sounds these particular dogs make are a cry for help, really, more than it is a cute sound. What are the screening factors that you use to determine if a patient is a good candidate?
So that is a great question. These patients have some specific differences from others, but they are also much like other dogs that we will see, because they require anesthesia, and we want to know if their internal organs will tolerate the anesthesia and if there are any specific special needs for that particular patient. So every dog that I see and that we see here at the hospital for Boaz has an electrocardiogram to check the heart. Many of these Brachycephalic breeds have lower heart rates. They require a medication prior to anesthesia. And we need to make sure that we recognize that before they go under anesthesia. The other important factors that we take advantage of are things that we can do to recognize a problem before anesthesia. So without doing anything invasive, we can get images. These are crucial images of their airways before they go under for an airway surgery. I mean, it kind of makes sense. Why would you, not want to know what you're getting into before you have them under anesthesia? They need to have healthy lungs. They need to have a healthy internal organ as far as their functions before we know they're good candidates. So I do have high quality x-rays taken of the upper airways here in the neck. We can visualize often and recognize often that there is an elongated soft palate, or if it is thickened. We specifically get high quality images and send them to a radiologist and ask them to comment on whether or not this dog has an upper airway abnormality, whether this dog has a collapsing trachea if the airway is very small, whether they have mineralized cartilage, whether they have fibrosis in the lung, whether they have every evidence of bronchitis that should be treated before they go under anesthesia, whether they have a pneumonia that hasn't resolved, whether they have a hiatal hernia, the stomach is a problem, which is going to increase the risk for them to regurgitate. All of these things are important. Of course, the routine standard things are appropriate blood work. So we want to know their liver and their kidneys can handle the medications that we need to give them for anesthesia. We want to know their complete blood count, their platelet count. We want to know that there's, things that are important that can happen if there is an issue. We need to recognize it before, we get into that problem, so that we can make sure we provided them the safest way to have that procedure and the recovery.
Right. Well, the if you kind of look similarly to humans, if you're not able to properly take in air, that causes so many other issues, where things can either break down or it weakens them. So, sometimes, so if they've got obstructions up top or inside their nose and all that good stuff, and are heavy snorers, sometimes they condition their bodies to take in less oxygen. So instead of being at 100, they might be at an 80 something, 85 count. So I'm guessing you want to test for that, what their oxygen intake is prior, and so that you know how to adjust while you're doing your surgery, and then see how the surgery affects increasing their oxygen intake. Lack of oxygen. Go ahead.
Absolutely. You're exactly right. Pulse oximetry is something that's been available. You can easily get a pulse ox on Amazon now and check things like this at the home. You can put it on your dog's tongue. You can attach it to the ear. Their oxygen saturation should be close to 100%, but most of these dogs do not have that. And believe it or not, when they are under anesthesia, they are breathing better than they ever had, because now they have a tube that's open, providing 100% oxygen airflow, whereas before there was nothing that, providing that open oxygen source, because they're so limited. And definitely something that is monitored before and after. Some of these dogs require oxygen before surgery and after surgery. It is important that these dogs are remaining intubated for an extensive time, because we know that's going to be the best breathing they ever have done in their life, because they have a tube directly into their lungs. So we will not remove that tube until we see that they are breathing appropriately.
Right. So you do a sort of oxygen therapy to help them heal afterwards, because if they can't, they need the oxygen to help them heal and everything. So I can understand that completely. Have you had measurable differences? And I'm sure that's like an obvious question, but are you able to show how your patients are able to breathe better after the surgery as compared to before?
Absolutely. This is the one procedure in our profession that I cannot compare to anything else, because your dog could come in with a lump and it could be a cancerous lump and I removed it, which is amazing because, we removed the cancer from your dog. But once we correct their airways and they wake up and they're like, oh my gosh, I can breathe through my nose, I can breathe through my throat. It's unbelievable. I always call it version 2.0, and that's why I'll put up my before and after videos so that pet parents see, look at this dog before. He was struggling. He was turning purple. He was having heat stroke. He was having aspiration pneumonia. He couldn't go outside for a walk. Now look at the after, right after surgery, even weeks after. Dog is outside in the South Florida heat, and he's doing great. So, my story is really seeing is believing. And until we can see these things regularly, people won't believe it. So it's our responsibility to show what we do and the value of the things like this that can help their pets live and breathe and thrive. Because when we corrected their airways, we prevented them from going into heat stroke. We've prevented them from going into that collapse. We've prevented them, God forbid, a million times from dying on that airplane, okay? So these are things that we can do that are so rewarding, and there's really nothing like it. And that's why I have become so passionate about not only doing it here at the practice, but teaching veterinarians across the country how to do this. Because once you learn to do this and this skill that you obtain, there is nothing on earth that will make you feel better than seeing a dog suffering who can't breathe, wake up breathing like he has a new life. It is absolutely amazing, and it never, ever, ever gets old.
That's fantastic. I can imagine, and that probably, fuels you to keep going. Like you want to fix every one of these breeds that you see, just to give them a better quality of life. Because breathing is the simplest thing we should be able to do. So,
Amen.
I know earlier you had mentioned the extreme brachycephalic breeds. I wanted to go back just for a second so that you could. I think you mentioned there was two. And what are the risk factors for them?
Yeah, so the extreme brachycephalics are the dogs with flat faces that have the flattest faces out of all of the flat-faced dogs. So the short nose, we should say, the brachycephalic. So the Frenchies are number 1, English Bulldogs number 2, and Pugs are number 3. The risk factors are, the most common, if you look into the studies that are concerning, are post-operative aspiration. So they can have an upper airway problem that they live with all their life that can turn into a lower airway problem where they get an infection in their lungs. Now, when they get an infection in their lungs, if they get aspiration pneumonia, that is something that's treatable, but it does require hospitalization, and it does require oxygen and injectable medications, which is costly. So we've learned that before putting dogs under anesthesia, we start them on medications to lower the risk of regurgitation and vomiting. Weeks before the procedure start, we start them on these meds so they can get used to regurgitating less, so they can get used to breathing better or eating without regurgitating. Once we have seen that these dogs are on the appropriate meds before surgery, we continue them on those meds after surgery to help reduce the risk of them regurgitating and getting an infection that goes from their upper airways to their lower airways. Now that is one risk, but another risk that everyone's scared of is bleeding. Why in this surgery in particular? Because if you have a bleed in your mouth and it goes into your lungs, then you got a problem. And that's why laser surgery has been a revolutionary game changer for this procedure, because it does not require sutures. There is less inflammation, there is less bleeding, and those complications of bleeding are virtually minimized. You can never say they're eliminated, but they are minimized significantly when you have the appropriate technology and you have the appropriate experience to perform that surgery with a high quality CO2 laser.
Wow, I can imagine. So then with that, oh, did it pop up? There it is. What is the healing process after the surgery?
So as far as the healing process goes, when we intervene with these brachycephalic dogs early, the chances of them having a speedy recovery increase. Why? Because they're young and they're healthy, and that negative airway pressure has not been going on for years and years in their little bodies. So when we do it early on, their chances for a complete, quick, and speedy recovery is very, very high. We have these dogs come into us in the morning, and I have the pet parents in the exam room here in the hospital with them as soon as they're awake enough to be with them in an exam room. Why? Because we don't want these dogs waking up in a steel cage behind the scenes with people they don't know. We want them with the pet parents, because if you have a surgery, are you going to want to wake up alone with people you don't know? Answer is no. You want to be around your support system. That's what these dogs need. They're very, very smart, and they have a bond with their pet parents. So those pet parents are an important part of recovery in the hospital with them, and they go home the same day. We consider this an outpatient procedure because an overwhelming majority of them come in the morning. They are here for a few hours. They wake up midday. They go home in the afternoon. As soon as we see they're walking around, they're breathing, and they're doing well.
The older dogs, will you keep them overnight just to make sure everything's okay?
So we do all of these screening things that we discussed, their ECG, their x-rays, their blood work. And when they're senior dogs, there are other things that can come into play that can be higher risk factors. So it's important that we do our homework before we decide to do these senior dogs that have been living like this for many, many years. Because just like you said, it may come down to a point where it is more appropriate for a senior dog who has multiple health issues to have intervention at a 24-hour facility, so that if we have these things come up where they have higher risk factors, for example, they now have heart issues, right? They have a heart disease. They have, for example, chronic regurgitation. They have had heat stroke. They have had changes in their lungs. They have higher risk for laryngeal paralysis, even if they're elongated soft palate and their nose is corrected. These guys may need to be at a ER where they have not only ER doctors, but criticalists. Those are ER doctors who specialize in critical care and dogs like this that are higher risk, that might need something like a tracheostomy or a tracheotomy after surgery. So really the goal is, the senior pets are not where you want to start when you're learning to do these things. And they're certainly, not the ideal candidate. You want to start them when they're young, which is why I have been so vocal about doing these things early on.
I get it. And, it seems like the younger you do it, the less complications, the easier the recovery will be. And the body has not start to get any bad effects from not being able to breathe. Where if you wait until they're older, now you might run into some complications. And so it's just so much better to do it when they're younger and, use it as a preventative step instead of a reactive step.
That's exactly right. We actually have called it in our profession a paradigm shift from being reactive to proactive. You don't want to be a reactive physician or veterinarian or anyone. You want to be proactive, starting early on to help these dogs.
What are the resources for pet parents that help provide details to the Boaz laser surgery?
So the resources for pet parents are available through, educational sources that I can think of would be the American Laser Study Club. Now, the American Laser Study Club is a group of not only veterinarians, but physicians who provide laser surgery for different things. For example, they use the same high quality CO2 laser for babies that have neonates, that have tongue ties. and different things in dentistry that require laser surgery. But the veterinary side has its own side of veterinary surgeons who have dedicated themselves to providing laser surgery. And so we have dermatologists, we have ophthalmologists, we have surgeons, we have general practitioners, all kinds of veterinarians who have been exposed to laser surgery, who have been laser surgeons for many years, who have share the content of the cases they have, like myself, online, so that we can learn, we can educate pet parents and also fellow veterinarians about how to, perform these procedures. And for pet parents, I would say continue to Google and to research what you can about Boaz, and find the resources online, because it's a different world today. People come to us through YouTube, through our YouTube channel, through Google, and there are so many others like us around you. The most important thing I could say is, if you're looking for the laser in particular, on the website, on Vet Scalpel, there is located a laser surgeon button tool where you can put in your information, and wherever you are in the country, they can help to try to provide you with veterinarians who have experience with laser surgery.
That's great.
This has been such a great conversation, and very eye-opening. I just want to point out to everyone that because when we were talking about, the difference from when your patients come in to after they are able to breathe again, I wanted to point out to everyone to go to Dr. Mann's website and check out the before and after stories. He's got them right on his website. You will be amazed. They are real stories of these babies, just like yours, that Frenchies, pugs, even English bulldogs, like you mentioned, that, have that breathing situation after going through the surgery, living a new life. And I want to say they're jumping up and, if you can imagine, jumping up and their back paws are clapping together because they're so excited they can breathe like they normally should breathe. So definitely go to Dr. Mann's website and check out the before and after stories. I do have another question. So, I would imagine before the surgery, it's pretty tough for these babies to get in a carrier and, go through the whole process of flying on a plane. Have you heard any stories, or has anyone gotten back to you after they've had the surgery? Was it a different type of trip for the patient? Has the pet parent said they've seen a difference?
Absolutely. And being in general practice, we have a unique privilege to have a lifelong relationship with these dogs that we treat. And I stay in touch with a majority of all of these surgeries that we have performed, these dogs that suffered from airway issues, because my interest is to continue sharing their stories. So I will post their stories, weeks and months after, where they're out on a walk, having, a nice day out in the park, because long-term, it's important for pet parents to realize that the long-term benefits outweigh any fears that people have, because once you're able to see these types of stories, it's transformative, and it's a privilege to be able to be part of this process. And I'm really thankful, to be able to share these kinds of things. And I hope that, these types of stories will encourage others to seek care, whereas before they may have been more hesitant.
Yeah. I know your hospital is located in Boca Raton, Florida. And I'm sure you get patients from all over Florida. But are you able to take patients from across the country? Do they come to you? Do you go to them? Is that a good relationship if somebody wants to reach out from Nevada?
Yes, that's a great question. We do see out-of-state pet parents, and we do virtual consultations, and we do, overviews. through the ways that we can, through reviewing their medical history, because these dogs usually have one. And when we schedule an out-of-state pet parent, we have a protocol where we start them on medications before they come, like we discussed, to help reduce their chances of regurgitation on the flight, or before they travel, and then after the surgery as well. So that helps. But we also do a staging process as soon as they arrive to our hospital, because we want to know in real time what's going on with these patients. So all the tests that we discuss, we do them at the first consult, and then we send them home. And then the next day is when we normally schedule the surgery, as long as all the checkups come back acceptable, which normally do happen as long as we've had the virtual consult and discuss, their health risks appropriately. We're able to usually have them seen on the first day and surgery the next day. Then we ask them to stay one more night so that we can see them 24 hours later to make sure they're not having problems before they start traveling again.
Okay. And just for pet parents to understand the process completely. So I'm assuming, you reach out to the office and you schedule a consultation with you either in person or virtually. And then is there a long wait period until the pet can be scheduled? Is it like 6 months or a year later they get the procedure?
We attempt at every point to expedite these types of appointments because these are animal welfare problems. These are critical to address. We don't want these pets to have to wait 6 months to a year. That's normally not a great thing for these dogs, especially if they're already showing symptoms. Because months do matter in these cases. So we do try to expedite them. We can't always guarantee immediate appointments, but we definitely take it very seriously, and we try to prioritize these types of things.
Okay, fantastic. Well, it's funny. We're all the way to the end, and now our streaming service is acting right.
Yeah.
But Dr. Bryant, I wanted
and now
to
my internet works. It works now, which is crazy. I'm so embarrassed, but you know what? I know that Greta is very, very good at what she's doing as far as interviewing folks and pulling everything out. So I'm confident everything went well. I'm sorry I couldn't interject because I really wanted to have that rapport with you and everything, Dr. Boaz. I'm thinking, to be honest with you, maybe we need to try to retape another one and maybe do it off time, Greta. Maybe not during. We'll schedule it and then bring it back. I don't know. I feel like I missed something, but I know you did well. I know it's going to go well. I just feel left out because my internet went down. So I'm so sorry. I'm embarrassed. I don't know why it went down. Technology, right? But it wasn't my fault. But I'm glad you were here. Definitely. Yes. I know Greta has pulled out a lot of great information from you and everything. But I really want to interact with you more. And maybe, Greta, like I said, maybe we could schedule maybe another day that's not live, but we can make it live at a later time so that we can really have the rapport that I wanted to have with you. So
I think that there's a higher power trying to say that we need to do more together because of this. Maybe they intervene on purpose. They want us to continue doing these things together.
Right. Because
we got to do a whole series.
She does such a good job. This has only happened one other time, and she slammed it, knocked it out of the park. And I'm like, man, I wanted to play too. I wanted to have fun. But I know you're in great hands. But you're right. We need to continue this conversation. We need to do another one. We need to find other ways to work together because there's a lot of valuable information. And to me, okay, you said I may not have described you properly. In my mind, you are an expert at what you're doing. You may be a general practitioner, but you are focusing on brachycephalic breeds, and you're doing laser surgery. And it does, in my opinion, it doesn't matter if you're certified or not. You're doing something that most veterinarians don't do. So, in my opinion, you are an expert in what you're doing. So, take that.
Appreciate it.
Mm-hmm.
Dr. Bryant, I did ask a couple questions regarding to travel Are there any questions that you would like to get in now in regards to that?
Well, gosh, I don't know what you touched upon. Actually, did you mention something about cats? Brachycephalic breed cats.
I did bring that up.
You did? Okay. Because
You
that's
know
big.
I did.
You did? Well, yeah, I know you did with your kitties. That's true. That was something, like I said, I'm glad you covered that. The main thing I'll just mention, most airlines will embargo or restrict the transport of brachycephalic breeds, and that list is long, and also includes breeds that are inherently strong that can break out of crates too. So it's a long list, but that's going by cargo. But there's never anything telling folks about traveling with their pets in cabin, and they need to be aware that there's still risk no matter what form of, if it's in cabin or cargo. But they leave it up to the pet owner to decide on what they want to do for in-cabin transport, because technically it's under their care. If it's under the airline's care under cargo, that's a different story, because we're kind of legally bound for that animal and everything. Even something could happen with them, but it doesn't necessarily mean it's airlines at fault. But unfortunately, it becomes a DOT reportable event, and the airlines ding for it. So they embargo or restrict certain breeds because of that. And as you said earlier, the main breeds that were identified, pugs, French bulldog, English bulldogs, those definitely were the top ones that I know the DOT reported years ago that they know that these breeds have problems going by cargo. But what I'm bring that up to say, though, the embargo breed list or restricted breed list is for cargo, but folks need to understand they can have troubles also in cabin as well. So just stop.
Any stressful situation, will create a problem, because they already have a pre-existing problem. Mm-hmm. And when they have that soft palate in their throat, that's already a partial airway, if not a complete airway obstruction in their nose, and they get excited, what happens is the blood supply increases, the swelling increases, the salivation increases. All the things that are a recipe for an obstruction and a disaster, are there. Mm-hmm. So, it's important for us to continue educating pet parents about this problem and how to tackle it very early, and that will help a major in a way that's transformative for the airlines, for the transportation, for everybody involved, for us to have the conversation very early on.
I did want to ask this question. So for pug parents, French parents, and Frenchie pet parents, and English bulldog pet parents, so until these babies end up in your care, what are some tips that you can give them? Because all three of them can go in cabin. So what should those pet parents watch for or prepare for while they're traveling by a plane?
Yeah, so one of the things that I think that pet parents would benefit from is going to a website called Fear Free Happy Homes. There's a website that provides a lot of great resources for dealing with pets who become anxious and stressed and fearful. And these dogs, most of them fall into that category, because you can imagine, when they're home, even they're having a hard time breathing, and then you take them out of that environment, it's going to create more of a problem. So there's all kinds of natural ways for us to supplement them with things that can help to take their levels of fear, anxiety, and stress down. There are also medications that are important that can be provided by the veterinarian before, for example, a vet visit, to make their experiences better while they're at the vet. It can be safely prescribed or administered. And if your pet's going to be anxious and fearful while it's in a car or at the vet, the odds are it's going to be the same way when it's going to the airport or on the airplane. So if pet parents can learn to recognize the body language and the signals that are the triggers of these episodes, then they can be reactive and proactive in helping them, with when these problems present themselves. And that's why I'm also a big fear-free advocate. You can see I have it on my stethoscope, because, this is a big thing. There's 3 fears, okay? And this is important. Fear, anxiety, and stress of, number 1, the pet parent that doesn't want to go to the vet because they're anxious about their dog getting stressed. The second fear is that actual fear, anxiety, and stress of the pet that comes into the clinic, because when they start getting anxious and stressed, they know they're going to have a hard time breathing. And guess what number 3 fear is? It's us. It's us veterinarians who run a general practice that don't want to stop everything we're doing because the pet now is in a respiratory crisis. We have other appointments. We got to stop it all. We got to get them on oxygen. We got to get them medications to relax them. We got to get them x-rays. Potentially, we got to get them intubated. We got to get thermal regulation started. So the real take-home message is conquer your fear, anxiety, and stress because this is correctable. These pets will do so much better. They can recover quickly. And the pet parents need to also conquer their fears of having the vet visits because when they go to a fear-free vet, sorry to plug it again, we take their emotional well-being very seriously. And if we recognize that they're having a problem, we're going to do something about it. We're going to make up that visit better. We might say, hey, your pet's not ready today. We're going to send you home with these meds. Next time, you're going to give the meds before the visit, and let's see how the dog does because that's so important. It happens with everyone. We get stressed when we go to the dentist. We get stressed when we have to go to the doctor. These pets are no different. So we got to make sure we address those things, and that's why it's so important.
Awesome.
Okay, that's great.
Let me tell you, a client said to me recently, because I'm trying to think, he did have a brachycephalic breed, and a dog, dog came in and it was aggressive, and he gave it CBD, and it didn't work. So we're saying, you know what, I'm sorry, we can't handle your pet because we need to give him something to sedate him so he's prepared for the examination. And he was saying, oh, you guys must do something to him to hurt them. And I'm like, well, sir, when we go to our physician, if you think about it, we're exposed to things that we don't necessarily like either. Okay. I might need vaccines and I hate shots personally. I might have to get blood drawn and I hate that, but I have to tolerate it, right? You can't mentally prepare a pet for that and and expect it. And of course they're going to be fearful. And if they're fearful, some pets will show aggression. So, it's not as though we're purposely trying to harm them. The whole process, unfortunately, you have to do certain things to further diagnose and come up with a diagnosis of what's going on with the pet. And of course, it's going to take poking and prodding, and unfortunately, but we don't, as a profession, personally do things to try to harm a pet.
Yeah,
that is not our role as veterinarians. So we're trying to help as much as we can. I have not done fear-free yet, but I am actually going to get that's the next step that I need to conquer. And I love it because fear-free goes in line with a lot of things that I'm thinking that's needed for pet travel. Being more pet-centric is extremely important. And that's what I do as far as the information I share. I'm focusing on the pet and what they're going through the process and what our pet owners can do to help them and assist them with the process. So
we can do a whole nother video on just fear-free and how it relates to traveling and Boaz. So let's do it.
Yeah,
absolutely.
Yeah. And hopefully
one last question, I promise. One last question for the both of you. Mm-hmm. So, okay, is it possible as a pug parent, Frenchie parent, or English bulldog parent? I know they have portable pet oxygen. Can I get one of those? And do you recommend me getting one of those for my baby, and especially when I travel in cabin? Is that something you both would recommend?
That is a great question. There are, I have recently had an experience with a service that is actually tailored for the critical dogs that we see. They actually have a little ambulance with oxygen that will pick them up from a practice like mine and take them to a critical care center. Nice. Because they may have a respiratory issue, and they have those portable oxygen concentrators. I think that it could be a big challenge to get that approved for an airline. I'm not sure Dr. Bryant would probably have more to say about that. But I know that at home, we want to try to avoid having that need for them, because if they have a need for that, that means that we haven't, intervened soon enough. And, that is something I think should be reserved only if you have already corrected the airway problems and they're still having an issue, which is highly unlikely. But there's always a solution that seems to be somewhat better than that.
Yeah. The airline, I'll just tell you that an oxygen canister of any sort can be considered dangerous goods. Think about it, could be flammable. So that's not something that's easily, that you can easily board an aircraft with. So that would have to be definitely special permissions for it. So it's not a routine thing that's done for pets. But an interesting thing too, if a pet needs oxygen that bad, they don't need to be traveling by air. They
don't need to be on the plane.
They don't need to be on there, okay? So yeah.
Well, that's the last of my questions. But I figured since we had good signals and we got started a little bit late, I figured we would go past our hour. But do either of you have any other last things that you want to share with everyone?
I don't have anything. I'm just happy you were here, Dr. Boaz. And yes, we're going to find ways to continue working together. I really appreciate you being here. Any last words for our Brachycephalic breed owners that you can share?
I think that these dogs are amazing and that they are popular for a reason. They are intelligent and they deserve the best care. They became popular for a reason, because these dogs bond with us, we bond with them, and it's important for us as pet parents to do everything possible early on in their lives to make sure they live a long, healthy life. And that is our oath as veterinarians, as pet parents, as pet lovers everywhere. So I'm happy to be part of this conversation, thrilled to continue doing my best to help spread the word about how we can help these dogs. And thank you so much for having me here.
Great. Well, thank you.
Absolutely.
Thank you.
Well, this certainly was a very interesting live that we had here. And I'm sure that people will enjoy the recording. Thank you so much, Dr. Mann, for being with us. I really appreciate this. I learned so much, and we definitely will have to create our own series with you so we can bring you back and continue to do this.
My pleasure. Thanks again.
Well, everyone, thank you for joining us, and we look forward to speaking with you with other Facebook Lives, and we hope that you have a really great weekend. Dr. Mann, if you can hold on 1 second, I'll just end the stream, and we'll be able to just talk for a second afterwards. But everyone, have a good day.
Bye. Thank you.